I am Ashish Mishra, Assistant Professor in the Department of Pharmacology, welcoming you all in the topic anti-epileptic drug. Today, I am going to discuss about the drugs which are used in the epilepsy disorder. First, in this presentation, I concluded all the topics related to epilepsy as well as the drugs treat against epilepsy. So, what is epilepsy? These are the group of disorder of central nervous system basically characterized by the recurrent seizure. It is a disorder related with the disturbance of consciousness with or without characteristic body movements, sensory or psychiatric phenomena. Seizures are sudden, transitory and uncontrolled episodes of brain dysfunction resulting from abnormal discharge of neuronal cells with associated motor, sensory or behavioral change. According to the prevalence of epilepsy, there are 2.5 million Americans with epilepsy in the United States alone, as well as more than 40 forms of epilepsy have been identified. Epilepsy has a focal region in the brain and that depend on the site where the neurons imbalance. Basically, the causes of acute seizure may be trauma, encephalitis, drugs, birth trauma, withdrawal from depression, tumor, high fever, hypoglycemia, extreme acidosis, extreme alkalosis, hyponatremia, hypocalcemia, idiopathic. There are different forms of the seizure that may involve generalized seizure as well as a partial seizure. This diagram represents the two types of seizure, generalized and partial. Partial have a simple partial seizure as well as complex partial seizure, as well as the simple or partial or complex partial seizure secondarily generalized. But in the case of generalized seizure, tonic-clonic absence seizure, atonic seizure, myoclonic seizure, as well as infantile spasm have been identified, and based on their symptoms, the drugs have also been used separately for different seizures. First, we talk about partial seizure. What is simple partial seizure? Basically, it involves the one side of the brain, and in the simple partial seizure, that is a Jackinson, it involves the sensory or speech disturbances basically confined to a single limb or muscle group. There is no alteration of consciousness. This is a diagrammatic representation of the seizure in which the convulsions are confined to a group of muscles. All the localized sensory disturbance basically depending on the area of cortex involved. Now, the complex partial seizure, it is a attack of bizarre and confused behavior. It involves the confusion and inappropriate behavior. Motor activity appears as a non-reflex action. It lasts for 1 to 2 minutes along with the impairment of consciousness or loss of consciousness. The seizure focus is located in the temporal lobe. Now, in the generalized seizure, different types of seizure have been identified. That is a generalized tonic-clonic seizure that lasts basically from 1 to 2 minutes. In the generalized seizure, it is also known as a grand mal seizure. The clonic phase involves the alternating contraction and relaxation causing a reciprocating movement which could be bilaterally symmetrical or running movements. Now, second is the absence seizure. Absence seizure, also called a petit-mal seizure. Basically, it involves the loss of consciousness, sometimes with no motor manifestations. In the absence seizure, the EEG shows the characteristic 3 cycles per second spike and wave pattern. There is a no muscular component or little bilateral jerking in the absence seizure. It often begins during the childhood, daydreaming, attitude. Basically, the calcium current has been found to govern oscillatory responses in thalamic neurons, and it is the most probably ions involved in the generation of these type of seizures. Now, next is a tonic seizure, which involves the loss of consciousness, marked autonomic manifestation. Atonic seizure, it involves the loss of postural tone, it and as well as the sagging of head or falling, and may lose the consciousness. Now, next is a clonic and myoclonic seizure. Basically, the clonic seizure involves the rhythmic clonic contraction of all the muscles, loss of consciousness, and marked autonomic manifestation. Myoclonic seizures involves the shock-like momentary contraction of muscles of a limb or the whole body. Next is the infantile spasm, which is seen in the infants, probably not a form of epilepsy. Basically, in the infantile spasm, intermittent muscle spasm and progressive mental deterioration have been characterized as the symptoms. Now, based on these forms of the epilepsy, different mechanisms have been attributed to act. That is three main mechanisms involved: enhancement of GABA, because GABA is an inhibitory neurotransmitter, and the imbalance in this neurotransmitter leads to the epileptic disorder. Second is inhibition of sodium channel function, inhibition of calcium channel function, as well as other mechanisms also include, that is inhibition of glutamate release and block of glutamate receptor. Because now the GABAergic synapse, there is a diagrammatic representation of the drugs that act on the GABAergic synapse. Basically, GABA agonist, GABA antagonist, barbiturate, benzodiazepine, GABA synthesizing enzyme, GABA uptake inhibitor, GABA metabolizing enzyme have been involved in the release of the GABA in the postsynaptic terminal that further decrease the firing of neurons. Now, the glutamate is a very important neurotransmitter that is involved as an excitatory neurotransmitter in the brain region, and the increased flow of which cause the epilepsy. Basically, the drugs basically block the glutamate receptors that cause the treatment against epilepsy. Now, the various drugs are used involved in the anti-epileptic disorder. First, the main important drug, that is the phenytoin. Phenytoin is the categorized under hydantoin drug. It is the oldest non-sedative anti-epileptic drug. Basically, it changes the sodium, calcium and potassium conductance, as well as it alters membrane potential, amino acid concentration, as well as the neurotransmitters. The toxicity involved in the phenytoin is ataxia, cognitive impairment, hysterism, gingival hyperplasia, coarsening of facial features, dose-dependent zero-order kinetics. At high concentration, it causes a type of decerebrate rigidity. Next, carbamazepine. Basically, it is categorized under immunostilbene. It is a tricyclic antidepressant. Mechanism of action similar to phenytoin, but it inhibits the high frequency repetitive firing, as well as it decreases synaptic activity, inhibit the uptake and release of noradrenaline, as well as uh, it is a metabolic, but it does not inhibit GABA as a neurotransmitter. The toxicity involves the auto-induction of metabolism, nausea, visual disturbances, granulocyte suppression, aplastic anemia. Oxcarbazepine, it is closely related to carbamazepine with improved toxicity profile. It is less potent than carbamazepine. Basically, it is used in the partial and generalized seizure as adjuvant therapy. It involves the sodium ion change as well as inhibit the high frequency repetitive firing. The toxicity involves the hyponatremia, less hypersensitivity. The next drug is a phenobarbital. Basically, it involves under the barbiturate category. It is the oldest anti-epileptic drug and considered as one of the most safest drug, but have some sedative action. And in infants, it is a drug of choice. It is basically used for the partial generalized tonic-clonic seizure as well as febrile seizure. It helps to prolong the duration of chloride channel, block the glutamate receptor, blocks calcium current. The toxicity involved in the phenobarbital is a sedation, cognitive impairment, behavioral changes, induction of liver enzyme, as well as it may worsen the absence and atonic seizure symptoms. Next is a primidone, that is basically categorized under deoxybarbiturate. It is a metabolized to phenobarbital and phenylethyl malonamide. That is both are the active metabolites and further involved in the decreasing in the repetitive firing of neurons. Basically, the mechanism of action may be closer to the phenytoin than the barbiturate. It absorbed completely, low binding to plasma protein, should be started slowly to avoid the sedation as well as gastrointestinal problem. The toxicity related to the primidone is same as the phenobarbital. Sedations occurs in some patient as well as some patient also complains about the gastrointestinal as a side effect. Now the valproate is the most important category, that is categorized under aliphatic carboxylic acid. It is also known as sodium valproate, fully ionized at a body pH. It is one of the most oldest drug as used previously. The mechanism of action is basically similar to phenytoin. It increases the level of GABA in the brain, that is an inhibitory neurotransmitter. It facilitates a glutamic acid decarboxylase enzyme and inhibits the GABA transporter in neurons and glia. Further, it decreases the aspartate. And basically, the toxicity involved in the valproate is elevated liver enzymes, nausea, vomiting, abdominal pain, and heartburn, tremor, hair loss, weight gain, idiosyncratic, hepatotoxicity, negative interactions with other anti-epileptic. Now, the next drug is ethosuximide. Basically, it is categorized under succinimide. It is a drug of choice for absence seizure. Basically, the mechanism of action involves the reduction of low threshold calcium channel. At high concentration, it blocks the sodium potassium ATPase pump as well as depress the cerebral metabolic rate. It inhibits the GABA aminotransferase. The toxicity involved in the ethosuximide is gastric distress including pain, nausea, vomiting, headache, hiccup, euphoria, skin rashes, lupus erythematosus. Next is the vigabatrin, that is a newer drug. Basically, the absorption is rapid, bioavailability is about 60%. Is used for the partial seizure and West syndrome. It is an irreversible inhibitor of GABA aminotransferase enzyme that is basically responsible for the metabolism of GABA. Basically leads to the increase the GABA effect. The toxicity involves the drowsiness, dizziness, weight gain, agitation, confusion, psychosis. Next is a tiagabine. It is a derivative of nepicotic acid. Basically, it is also a Naval drug is 100% bioavailable, effective against partial seizure in the patient at least 12 years old, and it is used as an adjuvant therapy. It is a GABA uptake inhibitor. Toxicity involves diagabine is abdominal pain and nausea, dizziness, nervousness, tremor, difficulty concentration, depression, asthma, emotional liability, psychosis, skin rashes. Among them the some drugs are safely used in the case of pregnancy, like phenytoin, phenobarbital, carbamazepine, primidone. But along with them, the drugs also used that may cause a teratogenic effect, like valproate that causes spina bifida, topidamate causes a limb agenesis in rodents and hypospadiasis in male infants, and zonisamide that is a teratogenic in animals. So it is not used in the pregnancy. There's some interactions between the anti-seizure drugs. Carbamazepine with phenytoin, it increases the metabolism of carbamazepine. When it taken with the phenobarbital, it increases the metabolism of epoxide. Phenytoin with primidone, it increases the conversion to phenobarbital. When we taken the valproic acid with the different drugs like clonazepam, phenobarbital and phenytoin, it may precipitate a non-conversive status epilepticus, decrease metabolism, increase toxicity, displacement from binding, increase toxicity respectively. Now, some also other drugs interaction involved with antibiotic, anticoagulant, cimetidine, isoniazid, oral contraceptive, salicylate, theophylline. Thank you very much.